How does PGD work for CF pregnancy? Imagine being able to choose the healthiest embryos before pregnancy even begins. That's what preimplantation genetic diagnosis, or PGD, offers for couples at risk of passing on cystic fibrosis. It's a powerful tool used alongside in vitro fertilization to help ensure a child is born free of this genetic condition. The process starts with IVF, where eggs are collected from the woman and fertilized with sperm in a laboratory. After fertilization, the embryos are allowed to develop for about 3 days, reaching the 6 to 10 cell stage. At this point, a tiny sample of one cell, called a blastomere, is carefully removed from each embryo. This cell is then analyzed in a specialized genetic lab to see if it carries the mutations in the CFTR gene that cause cystic fibrosis. If the genetic testing shows that an embryo does not carry the CF mutations, or if it is only a carrier, which usually does not cause symptoms, that embryo can be selected for transfer into the uterus. This way, the chance of passing on cystic fibrosis is significantly reduced. Some clinics now perform the biopsy at a later stage, called the blastocyst stage, around day 5 or 6. They take a few cells from the part of the embryo that will become the placenta, which may be gentler on the embryo and improve success rates. However, this method is more complex and not yet standard everywhere. PGD offers a major advantage over traditional prenatal testing methods like amniocentesis or chorionic villus sampling. Those tests are done during pregnancy and can sometimes lead to difficult decisions if cystic fibrosis is detected. With PGD, testing is done before pregnancy, so couples can choose to transfer only embryos without the disease, avoiding the emotional and ethical dilemmas of pregnancy termination related to CF diagnosis. For people living with cystic fibrosis or who are carriers, PGD provides a way to reduce the risk of passing on the disease while still pursuing pregnancy. Success rates vary based on factors like the number and quality of embryos, but studies show that about 22% of PGD cycles with egg retrieval result in ongoing pregnancies, and around 28% lead to a live birth. Importantly, well-conducted PGD procedures have not reported misdiagnoses, making it a reliable option. It's essential to remember that PGD testing is tailored to the specific mutations in the CFTR gene that the parents carry. Because cystic fibrosis can be caused by many different genetic variants, genetic counseling is a crucial step. Counselors help couples understand their risks, the testing process, and what to expect from the results. In summary, PGD for cystic fibrosis involves creating embryos outside the body through IVF, carefully testing each embryo for CF mutations, and then selecting only those without the disease for transfer. This approach helps couples reduce the chance of passing on CF without the need for invasive testing during pregnancy or difficult decisions afterward. Always consult with fertility and genetic specialists to explore this option and ensure it's right for your individual situation. Remember, personalized medical advice is key to navigating this complex but promising process safely and effectively.